When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Quebec dentists are fed up. 1,300 of them have withdrawn en masse from the public healthcare system as of today. With more on this, let's go to one of those dentists. Doug Hamilton is from Westmount Dental Care, and full disclosure, Dr. Doug Hamilton is my dentist. Hi, Doug.
Hi, Elias. How are you?
I'm good. Can we just put the cards out on the table? You have seen my mouth. You've examined my mouth. It's clear that I have excellent teeth and I floss every day. Can you tell the listeners if that's the case?
Well, I really can't talk about private issues without written consent. But Elias, giving you your verbal consent,
verbal consent.
I will attest to the fact that you have a wonderful mouth.
Thank
you do.
You know what? I go to the dentist, this is a true story, every 3 months. The reason I do it is because I have really good health coverage, right? I got my private insurance here at work.
Yes.
Other people, not so lucky, and there's a whole bunch of people that fall under the public healthcare system.
Yes.
So why don't you tell us first off, because not everyone falls under this, who does this really affecting? This withdrawal, who is, I'll use the term, paying the price for now?
Okay, so let's go back historically. Quebec typically had very bad teeth. People weren't participating with dentists. The dental health was very bad. People were sick, really literally getting sick with abscesses and things. We had to make access to care affordable, make it so that people could get care. There was a generation of people losing their teeth. And in the 60s, or I think it was 1960 actually, they started dental care for children, and they also provided welfare dental care. And everything was covered for the kids up to about age 16. And so a whole generation comes through now. They get all the preventive care, and now they have a nice set of permanent teeth protected with fluoride and sealants. And these people today enjoy really great dental health, and they're not missing a bunch of teeth, and they haven't had a bunch of abscesses and all the rest. So that was the intent of the program. And at the time when they adopted it, they were paying the dentists, a decent rate. It wasn't full rate, but paying the dentist a decent rate so that dentists could afford to do all this care. And it was really great for the population. Now let's take a look. Swing ahead a whole bunch of years. In between 1960 and I think it was the year 2000 or something, there wasn't a single raise in pay. So we were doing the work.
From when to when?
1960. About 40 years, there was no adjustment in the fees.
What?
So
that's crazy.
It's crazy. So what we were doing was providing dental care with less and less real dollar remuneration, and that meant that the dental care that was formerly subsidized by the government is now subsidized by the dentist. In fact, for years, we love the kids, right? We want to provide care, and so we do it, but we're subsidizing the care. Okay.
So everyone else has to pay for it at the end of the day.
Well, what's happening is the dentists were bearing the extra cost because, and I'll give you an example. If I'm going to pull a tooth on a child and I want to be very kind to the child and I have to freeze them and we're going to treat them nicely and we get them calm and we provide a good environment and it takes me half an hour to do that, I get paid $8.
Whoa.
Okay.
Yeah.
So $8. It cost me $20 just to put them in the chair. Then I have to pay my assistant who gets paid way more than $16 an hour. Okay. And I don't get paid anything. I also have to pay for the materials and I have to pay the rent and et cetera, et cetera. So the $8 is a multiple of $8 doesn't pay for the cost of delivering the care.
So the protest that you're doing, that you and a whole bunch of other dentists are doing, you're still going to provide the service, correct? But you're not going to have the automatic billing, so that's just going to lead to more paperwork?
Services are available. They'll always be available. But the problem here is that because the service has been offered at such a low amount and doctors were actually paying for the care for the patients, it got to the point where it was untenable. And if you lived in an area with a ton of children or an area with a lot of welfare work, practices were literally going broke. So in order for the businesses to survive, they had to withdraw from the system.
Jeez.
And people were dropping out all over the place. And then the government got upset. And we said, well, look, we can't go broke providing the services. Let's be truthful about it. The doctors are subsidizing too much of this care. We had to do a similar action years ago. There was another one in 2015, a complaint then, and they did give us a bit of a pay raise. It still wasn't enough, but it was a start with a promise of more. And then in 2018, we did the same thing. We threatened the same thing, to withdraw the services because the contract is ridiculous. And what, at the time, the Minister of Health, was it Barrett, I think his name was?
Yeah, that's
he
him.
accused us of being greedy doctors and threatening the welfare of children. We're irresponsible and greedy people. What we're trying to do here is save the service. If we can't get paid enough to have at least a break-even point, we can't continue. And we want the service to go on. So what's going on is, the truth of it is, the government doesn't want to continue paying for the service, and they want an out, and they're looking for somebody to blame.
Oh boy! Let's take up on that. We're speaking, by the way, with Dr. Doug Hamilton, dentist at Westmount Dental Care. You just said they're looking for a way out.
I think they're looking for a way out because they have been peeling back on the services provided for years. I mean, it used to be covered 100% up to age 16, and now it's like age 10 or 12. I mean, they've eliminated a lot of the services that are covered, and they've eliminated the age groups that they cover. They've been peeling back on what they actually cover in the service too. So bottom line is that I think the profession understands that they're not really serious about continuing a proper healthcare service for people who are underprivileged. And if they can blame the dentists, they're happy to do that.
That's a really stark situation there.
That's my opinion. But I really don't believe, and I'm not speaking on behalf of organized dentistry here, that's my opinion. I actually have withdrawn from the system. I am no longer in the system at all. I've seen too many rounds of these negotiations, and in my opinion, the government is not interested. They're negotiating in bad faith, and they don't want to provide the service, and they want us to take the blame for it. So what the doctors are saying here is, we understand that electricians paid by the government, truck drivers paid by the government, they get paid the full amount, and the government workers get paid their full amount, they get their index pensions. We just need enough money to keep our businesses afloat. And we're not getting that.
I got to say, that's a great argument, right? It's not like, when you have an electrician or anyone who's doing drywall or anything in a government office, it's not like, it's a government rate, you get 50 cents on the dollar.
They get overtime, and they get double time on the weekends. So what we're saying is that if we have underprivileged people in this province, and we have a lot of them, they need care, because without dental care, it can be very dangerous to their health, and we need to support them. But we need a mechanism whereby doctors can continue to do that. And right now, with the fee structure that the government office is offering, it's not tenable. We can't run these practices with these low fees. It's below our costs.
What percentage increase would you need to get back on the program?
Elias, I can't tell you that number, but if you will get the Quebec Dental Surgeons Association on board, they will give you exact numbers. And they know exactly, they've done all the studies, they know exactly what the average fee has to be. It varies from doctor to doctor. Certain doctors have higher expenses than others, but they are really negotiating in good faith. This has been an ongoing fight. This is multiple times we've had to threaten to end the program in order to get the government's attention. And the only reason they're actually listening to us now is because people like you are talking about it in the news. It's become a topic. But I think we have to be very clear here. The doctors are doing this to save the program for the children and to save the program for welfare individuals, because otherwise people just have to withdraw. Dentists are withdrawing from the program.
Dr. Doug Hamilton, dentist at Westmount Dental Care. Doug, it's a real pleasure talking to you. I'm back in February 19th is my next appointment.
I'll see you then, Elias.
Timing is good. Okay, thanks so much.